I've never thought about it costing me anything.
That's the quote right there. I never even thought about it costing me anything. Why would it?
I mean, to me, healthcare is one of the best things to be using our taxes for.
No, you don't pay $600 a month, babe.
I was racing BMX in North Carolina. I fractured my heel and tore my plantar fascia, and it cost me $800 to get an x-ray and a moon boot. In Australia, we have Medicare, and that's all covered, but as an American citizen, you would just pay that. That's crazy to me.
Yeah, there was resistance from the Conservative people. They believe in trickle down, but it's actually trickle up. They've managed to fool their people. Oh, we'll look after you, you can trust us.
Some of the Conservatives are pushing to kind of make our system more like your system. Why should I be paying for somebody else's healthcare? We should all just be fighting it out like dogs on the street.
I mean, we've never paid for medical. Our public healthcare system is top notch.
Yeah, we're so lucky.
Should be, I guess, a basic human right, but it's not.
I think everywhere in the world should have it. Like, it's a basic human right.
And I don't know how you don't have it.
Should be a beautiful day, although maybe a little warm. There we go. Thank you so much for choosing United today, and we'll see you on the next show.
My name is Adam Kurtz, and I am running for governor of Tennessee. So I'm a gubernatorial candidate, but I'm also a touring country musician. And I happen to be on tour right now in Australia. If you can see, there's the Sydney Opera House right behind me. Australia has Medicare for all. So I figured while I was here, let's talk to the people of Australia and see if they indeed like their Medicare system, how it works, who pays for it, what's the difference between the public Medicare and the private insurance system that they have. So let's have an open mind. Come with me on my adventure as we explore Australia and their Medicare for all system. Yeah, ditch for governor.
I'm Richie Clark, and we're from Blooming People in Fitzroy.
And I'm Emma Sheehan.
Tanae Brooks, fire technician.
Jay.
I'm Ben, I work at St Vincent's Public Hospital.
Denise.
And Libby.
And Libby.
I'm Margaret Scott, I'm from Sydney and I'm recently retired. I've been working for 46 years.
Jenny.
And Brett. For Australia.
Matthew Ian Taylor.
I am Monique German. I am a primary school teacher.
Sam Troy.
Am I going to be on the TV in America?
Yeah, unless you don't want to be.
No, I do.
We have both private and public healthcare
In Australia.
and both me and Mum and our family usually have gone for public healthcare because you still get most of the benefits, but for free.
Yeah, we just do public.
Medicare government system is fantastic. He's interviewing me. The Medicare system is great for emergency care and public health system. You can get a lot of stuff done.
It's fairly simple in Australia. Everyone has access to Medicare, and Medicare is bulk billed through all GPs.
Oh, bulk billing.
Lifesaver. It's
Some will go
free,
private,
basically.
But
Bulk bill is
essentially,
free.
the government pays for your healthcare. So if you get sick, you go to the doctor, you get bulk billed.
I don't have to pay for blood tests, I don't have to pay for x-rays.
No, never.
MRIs.
So bulk billing is a scheme where if you go to a doctor, Medicare will pay for the majority of your visits. Sometimes they can pay all of it. So if you need to go get a blood test or you need to go get an x-ray, it's not going to cost you.
X-rays, blood tests, hospital cover, it's all through Medicare. Bulk bill, which means that you don't have to pay anything.
Some of them bulk bill, that means you go for free, and others charge you. And if you want to look around, you'll find a bulk billing doctor, so you can see doctors for free. Our prescriptions are all subsidised by the health system.
Medication is all subsidised by the government. I've never heard of medication costing more than like $30 a packet.
My ADHD medication, my anxiety medication, under the pharmaceuticals benefit scheme, it's like $5.60. It's pretty cheap health-wise.
And low-income earners get like a healthcare card, which entitles them to a whole bunch more free, awesome stuff.
In Australia, you get a Medicare card and that covers x-rays, hospitalisation, casts, everything, all covered under Medicare.
You buy the corner of.
What's it called though?
Tim Tam Slam.
Tim Tam Slam! What's Tim Tam Slam? What's Tim Tam Slam?
Corner off on each side, and you use it like a straw. It's all soggy in the middle, and then it just melts in your mouth.
Oh, I'm an Australian, so I don't have it. I just have public. Man, when I've been sick, they've taken me to hospital, they've driven me in the ambulance and taken me there, and Medicare card, and then they'll take you wherever you need to go. Like they're not going to do cosmetic surgery unless your face gets smashed in by a rock or something, in which case they'll put it back together. But
And just put it in your mouth.
Pour in more too. I recommend it, Tim Tam Slam.
Can I tell you a little story about my father?
Yes.
He had a serious heart attack and we called for the ambulance, which should have been about $450, but he's covered by Medicare. He was taken to the nearest hospital where they stent. It was cutting edge technology back then. He had every cardiologist in the hospital gathered around him trying to save his life. He had the stents. Unfortunately, they couldn't save his life, but it was totally free. Totally, not a cent, not a single cent. And when I say totally free, I mean totally free.
I recently had to go to emergency. I had a hemorrhage in my kidney and I went to emergency and I got treated. I think it cost me maybe $10 for the paracetamol at the end of it.
So when I was 17, I crashed my bike and had a big crash and I perforated my bowel. I had to have big surgery. So it didn't still the surgery, cost my parents nothing.
When you had a heart attack, it didn't cost you a thing.
Nothing. Not a cent.
The public health system is fantastic. So it turns out I have a son who's done drugs. He's ended up having psychosis events. He has been in 6 mental health hospitals. Brilliant care. He's been picked up by ambulances more times than you think about. We haven't paid a cent, and he gets brilliant care, and it's all free.
So I've never been in a position to be able to afford the payments for private, but thankfully the public healthcare system, you're not going to have to pay a whole lot out of your own pocket if you do yourself a mischief. Yeah, I've had a few broken bones.
Why did I think you might have some broken bones?
I recently had to go into hospital. I was put under full anesthetic, 5 specialists working with me. There was like nurses, doctors, amazing care. And at the end of it, again, they were like, oh yeah, we're sorry, but the Nurofen that you need isn't covered. That's going to cost you $12. And I literally was in there for like 2 days with like heaps of professionals working for me, being lovely, they're all being paid properly. And I didn't have to pay a thing at all. And that's just there for us all the time. It's crazy.
Because everybody pays it through tax. It's not something you can opt out of. It's actually calculated through your tax income each.
So
flat white.
Yeah, what's a flat white?
You make flat white in this cup. 1 shot of coffee filled all the way with milk.
Can you make it with like an oat or almond milk or something like that?
Make it with whatever milk you like.
How about Wombat milk?
I've never had Wombat milk.
A Medicare levy and a tax that we all pay.
It's inconsequential. The Medicare levy is inconsequential. It's based on what you earn. So if you don't earn anything, you don't pay a Medicare levy. If you earn, it's based on a percentage of what you've earned.
Medicare levy is 2% of your taxable income. If you earn 50 grand, it's $1,000 a year.
There's a levy that you have to pay if you don't have private health insurance, but it's like $200 or something like that. Per year? Yeah.
We claim our tax back every year, and the Medicare levy is taken out of that. So instead of getting maybe $3,000 back, I might get $2,700 back.
To be honest, our public system is actually one of where a lot of the prestigious academic roles are. So
I also have private health insurance and I got that before I was 30.
You don't have to have the private health, but interestingly, our tax system penalises if you don't have private health. Did you know about that? It's a small amount.
I think it's like 30 or 31. Yeah. You have to have, if you don't have private health and then you get it after that point, there's a percentage loading that you have to pay.
How much do you pay for private health insurance?
So per fortnight, $75.
So we don't use the word fortnight.
Yeah, let's say $150 per month.
Which I just had to pay mine the other day. It's $700 for a quarter.
My private health insurance is $175 a month.
That's $2,800 a year for your private health insurance.
Yes.
So essentially, I see it as I'm just putting money in a savings account for later. Is how I see it, because you're going to get it back once I know I'm going to have an operation that's inevitable.
I personally don't pay for private health insurance.
We're still young.
The only reason you really have health insurance is for dental, optical, If you know that you're ambulance prone, or if you
That's
need
a good band name, by the way, Ambulance Prone.
yeah,
That
or if
actually
you-
is. I like
or
that.
if you-
Our taxes, I don't pay ridiculous amounts of tax, to be honest.
And what's the advantage of private?
For me personally, I have a pre-existing condition. If you have private health insurance, you can often
Skip
get
the queues.
Yeah, you can often get treated quicker.
So then I can say to a doctor, I want to go and get my knee replaced or my eyes fixed.
The advantage of private is you get to choose who your specialist is, and you might be able to get an operation earlier. But public, the benefit is you don't have to pay any money, and if you've got a serious medical condition that needs treatment, our hospitals will take you in.
What do you think the advantage is of have private over public?
Dental access, 100%. Teeth are probably the thing that I've needed the most work done with.
Wealthy people maybe have private health insurance, but honestly, all that really does is like maybe make some things quicker. Like you can get a knee surgery tomorrow.
What's it? Is that me? On the wall?
6 months ago, I was on an American cruise ship and I had a bad pain in my chest. I went into the hospital. We were there, 2 hours? Bill was $3,009. I wasn't insured to go for the 3-day cruise. It was only a 3-day cruise. She did ring a cardiologist. And
$900 for that.
That was $900.
Yeah.
Libby went back to argue when she saw the bill. Every Band-Aid, every cotton wool bud had been put on there.
Yeah.
I nearly had another heart attack.
It's an expense, out of your tax. It's better than the alternative. I'd rather be paying something towards it than not having the option there.
And having that opportunity extend to others who can't actually afford health. No one that's getting the free healthcare is abusing that in my immediate world anyway.
It just makes everything a bit more fair for people. Good.
All we've ever known.
But weirdly, we take it for granted.
You guys are taxed higher than we are, and your healthcare is not included.
We've been in hospital for minor things. Like we've been in there for a week. You never even think about in that moment, what's the bill going to be like? Like we just go home.
The cost of your healthcare, you would never go to America without insurance.
When I had Libby, there was a 180-degree view of Sydney. All the care, giving birth, the 5 days I had thereafter, all the food, the TV, everything. Not a single bill. You get these things as you need them.
Like if you're an emergency, you get taken straight to ER. Like they have to operate on you no matter what.
They will
That's
never
our
turn
public
you
system.
away.
No, if it's an emergency, it's an emergency.
You can't. They're not going to leave you there to die, and none of that is put on as an expense to you.
Oh yeah, I think people are proud of it.
Thank you.
Adam, nice to meet you.
You guys have been awesome. Thank you so much, Ben and Stella. And
good luck out there.
Yeah.
Thank you. Let's go get us some beers.
Yeah, we met between the sets, but he played such a great gig that I had to shout him a beers.
When you say shout a beer, it means buy a beer.
I would say we're the luckiest country in the world. Like actually.
Exactly.
Right on, brother.
Yeah, man.
That's sick.
I didn't want to leave, not because I am ambulance prone, because Australia is like a fantasy land where everything is done right. Back home in Tennessee, I have a gubernatorial campaign to win, plus people who love me. I learned that the Australian healthcare system is one of the most fair and affordable programs in the world. No one has to hesitate to call an ambulance. No one fears bankruptcy from basic or emergency care. Their healthcare is extremely affordable. Everyone I talk to feels overwhelmingly that they get their money's worth. If you fear long lines, you can buy private insurance and get your surgery tomorrow. If you can't afford that, you are not left on the side of the road to die. Medicare for all is humane, it's civil, and it's a basic human right. We can have this too. We just have to stop believing the lie that we can't afford it or that the care is somehow less. And we have to elect people who will fight for it. I will fight for it because we deserve it.
I'd vote for Ditch.
Vote for Ditch.
I would vote for Ditch.
Vote for Ditch.
Seconded. I'd vote for Ditch.
Vote for Ditch.
I mean, I would vote for this. You're going to vote.
I'm gonna. When I get to Tennessee. Which American accent can I do?
I'm definitely gonna vote for Ditch.
Ditch for Gov. How's that? Sorry, this is very boring. Do you have serious?